freezes, your brain blanks, and your whole body just stops functioning for a second? Well, you have to be prepared whenever that happens. So here's 6 simple steps on what to do if your friend ever gets shocked.
This is the first step you should do. Do not give the victim anything to eat or drink. Step 2. Lay the victim on his back, but do not move if there is a back, head, or back injury.
Step 3. Make sure that the victim gets adequate air.
Step 4. Give the victim more. Step 5. Rise the victim's feet and legs with a pillow. Lastly, step 6. If the victim vomits, roll the victim on his or her side and keep the windpipes clear.
Those are the basic steps on what to do when someone got shocked.
Let's hear the 5 basic steps you should do. Step 1. So place a clean cloth or gauze over the wound. Apply firm, steady pressure for at least 5 minutes.
Mana na? Tama na. Ikat ni.
Then steady pressure for at least 5 minutes. Elevate and ease your arm or leg above the level of the victim's heart if possible. Step 3. When bleeding stops, secure the cloth with a bandage. Do not lift the cloth from the wound to check if the bleeding has stopped. Be sure that the bandage is not too tight. Step 4. Check the victim for shock.
Tanaw-tanaw mo naman siya.
Step 5. Use tourniquets only when you cannot control the bleeding.
Those are the basic steps on what to do when someone got bleeding of wounds.
Step 1. Use a drain hose, emergency shower, or eye wash for at least 15 minutes to rinse away all traces of chemicals for removing any contaminated clothing from the victim. Going to time for 15 minutes to erase or rinse the chemical burning here. There's 1 minute and 57 seconds remaining or left for the rinsing of the chemical burn. Cover the burn loosely with a clean or dry cloth or special burn dressing. Step 3. Check the victim for shock.
Those are the basic steps on what to do when someone got chemical or compressed gas burn.
2, 3, go.
friend ever got burned? Here are 2 simple steps on what to do if your friend ever gets burned.
Step 1. Submerge the burn area in clove. Clean running water if the skin is not seriously affected.
Step 2. Avoid applying cream or any form of ointment.
Ever get heat stroke? This is what you're gonna do if your friend gets heat stroke.
Stroke is life-threatening, so this should never be taken for granted. Flush, hot and dry skin, rapid pulse, very minimal perspiration, and unconsciousness are signs of heat strokes.
You need to bring the victim to a cooler place and lie him or her on the back with feet up. Then loosen clothing and remove footwear.
Three, apply cold compress or wet towel on the forehead, neck, armpit, and extremities to cool the victim. Step 4. Treat the victim for shock or bring the victim to the nearest hospital.